Let's begin by reviewing the Navigator, which is the medium blue field to the far left with the white menu tabs. Starting with the first menu tab, the Patient Care Management tab populates or opens to the well, which is the light blue field in the center of the screen, the Patient Care Profile or Plan of Care. Items associated with blue that are underlined are hypertext items. Selecting those items or clicking on them opens up additional fields for viewing additional documentation or performing documentation tasks. The items listed in the well in alphabetical order are what we call care sets. The plan design for the Patient Care Management Profile is based on the premise of the plan of care and all things populating from the plan of care. Therefore, as you review the items in the well, you'll notice that some of these items are listed as problems, associated diagnoses, and others are care sets associated with standards of care for nursing. In any case, the care sets populate to the right essential flow sheets required for documenting each of those care sets. Just as standard plan of cares are developed, you have the ability to add goals and interventions to each of the care sets to the left. You also have the ability to individualize the care sets by clicking on those hypertext and selecting status changes, whether the problems are considered active statuses, resolved, pending, complete, discharged, and so on. As we further review the Navigator and the Well Patient Care Management Profile, we'll identify how to perform these individual tasks. Coming down to the All Assessments tab of the Navigator, selecting the All Assessments tab opens up a flow sheet list that was generated as we built our Patient Care Management Profile, created care sets, and attached essential flow sheets. Therefore, the flow sheet list identified below under the description column are all the flow sheets that were documented initially in the Patient Care Management Profile. Additionally, when additional flow sheets are necessary, you always have the ability to select from a drop-down menu more flow sheets and document those and add them to this list. Once again, in Module 2, we'll demonstrate how to document on each of these flow sheets. The next field of the Navigator is the Allergies tab. By selecting the Allergies tab, you have the ability to review active allergies or a history of all allergies, as well as selecting the hypertext for each allergy and identifying the type of allergy or severity, as well as whether the allergy was verified or not and by whom. The current process for allergy entry will continue in hard copy format using the medication reconciliation process, faxing the MedRec to the pharmacy, where the pharmacy will then enter the allergies for you into the MS4 Clinical Suite profile. You may also use a pharmacy communication form to communicate allergy updates or changes to the pharmacy as needed. The next tabs below are the Order Entry and Order Profile tabs. As a staff nurse, you should be familiar with the Order Entry and Order Profile tabs and will not be including those processes in this tutorial. Currently, registry nurses and clinical students will not be required to use the Order Entry tabs for placing orders on their patients. The next tab in the Navigator is the Patient Reports tab. Selecting the Patient Reports tab opens fields to the right with additional tabs for printing essential reports or electronic medical record documentation. The Patient Reports tab is not the same as the Reports tab of the main menu up above. The Reports tab of the main menu above is the essential tab for printing unit-based census, diet reports, clinical procedure preps, or provider census. The Patient Reports tab in the Navigator, however, is the tab that you want to select whenever you're searching for specific reports or documents within the electronic medical record that you want to print in hard format for your patient's chart. Once again, as we review the individual documentation processes in Module 2, we'll cover these tabs individually and how to select your reports. Moving down the Navigator, the next tab is the Account Information. This tab has not changed and remains the screen that you would refer to when printing a new face sheet or adding consults to your patient's electronic medical record. The tab below following also has not changed. It is the Insurance Information tab, listing the patient's primary, secondary, or additional insurance. Following the insurance is the local visit history. This is a new tab, and currently it is view only. However, as we build our electronic medical record, it will become available to you to view all patient accounts as needed, as well as sort them using the white arrows at the top of the well. Finally, the last tab, which is transcription, is currently not being used, however may become available as our build progresses for MS4. Let's briefly return back to the Patient Care Management tab and review the hypertext in the well. We identified that the Patient Care Management tab builds the patient's plan of care. The current design for MS4 is based off the assumption that all things should populate starting from the plan of care. Let's look at each of the hypertext tabs associated with the plan of care below and how it changes the view or allows you to further document. Beginning with the top tab called the Filter in Use hyperlink. When selecting that, you have the ability to identify or populate in the well below all care sets that are not just active but are also resolved or pending or inactive or complete. This allows you to pull up a complete history of care sets that were previously documented on the patient. Let's click on the hyperlink use now. Select All Status button at the bottom. Notice that it pulls all statuses with the exception of erroneous or voided items. Those items are permanently removed from the Patient Care Management profile. Then select OK. And now you can identify below that additional care sets are viewable inclusive of resolved items, scrolling down, as well as inactive items for this patient's Patient Care Management profile. The next hyperlink we'll review is the Log Review hyperlink. The Log Review is the location where nurses will document that their plan of care was reviewed. This tab should be selected and a log review process should be performed at the beginning and close of every shift. By selecting the Log Review tab, you open up a drop-down menu for all disciplines. This allows the plan of care to be interdisciplinary in nature. We'll close that field now. When a log review has been performed, it is then documented in the history of reviews. Anytime you see the yes word next to history of reviews, it lets you know that there have been log reviews of this patient's plan of care. You have the ability to review that history by selecting the yes hyperlink and opening a field that describes or lists the individuals who have reviewed that patient's plan of care as well as the date and time. Again, using the white arrow, you can always sort that. We'll return back to the Patient Care Management Profile tab. The next hyperlink down in the well is the Add a Care Set hyperlink as well as the Add a Problem. The recommendation is always to use the Add a Care Set tab whenever you are selecting plan of care items or care sets to populate into the well. By selecting Add Problems, you may or may not pull a care set that has associated goals and interventions pre-built into the care set. While you have the ability to look up additional interventions and goals and add them to that care set, it is a much lengthier process, and it does open the window to leave some out or negate to add all interventions appropriate for that care set when doing them individually. So it's recommended that you always use the Add a Care Set tab when looking for nursing diagnoses, standards of care, or problem sets to populate into the well. By selecting the Add a Care Set tab, you open a drop-down menu that allows you to search for care sets, similar to using the Order Profiles tabs of the Navigator when looking for orders to enter on your patient. Once again, as we document our patient care in Module 2, we'll review this more carefully. Returning back to the Patient Care Management tab, we'll take a look at one of the care sets that have been added to briefly review the description or the drop-down fields when selected. When clicking on any care set, A new field will open up, which allows you to individualize that care set for the patient. You have the ability to identify or individualize the schedule, meaning how frequently the care set should be reviewed or documented. For example, in this case, this care set, continuous from 7/19/2010, 15:30 until resolved, is identified as the schedule. Note it's a hyperlink. By selecting the hyperlink, we can open a drop-down menu and select additional schedules as needed depending on the type of problem. Additionally, we can identify the status of the care set. For example, this care set is considered active. Using the drop-down menu, we can always change the status when needed to pending, resolved, inactive, discharged, or erroneous entry. Further, we can identify the certainty of the care set problem, as well as the chronicity between acute, chronic, or periodic. We can add descriptions to the problem, as well as individual notes, and we can also indicate who provided the information regarding the problem. Returning back to the patient care management profile, each of the hypertexts below description have goals and interventions associated with each of these care sets. To view the goals and interventions individually, note that they all have a plus symbol next to them, indicating that this is a patient tree. By selecting the plus symbol, you can open the tree and view the goals and outcomes or interventions associated with each of the care sets by scrolling down. They're all in hyperlink form, meaning each of these goals and interventions can also be individualized, similar to the view that we recently just reviewed, selecting status updates, adding descriptions, and/or chronicity or certainty helps to individualize the patient's plan of care. Next, we'll take a look at the Goals and Interventions tab to the right. Note it's listed under the Add column, indicating that whenever there are goals or interventions that have been recommended or established for this patient's plan of care, you can select goals. Whenever they're available, they will be populated below into the well. Not all care sets have additional goals and interventions pre-formatted in MS4. Returning back to patient care management, the same concept is true for interventions. When selecting interventions, next to the care set, if there are available interventions to select for that care set, they will populate in the well below. Otherwise, a message of no suggested interventions are available will appear. Returning back to patient care management. Finally, the hyperlink texts under Assessment are flow sheets. As we previously identified, whenever you establish a care set, pertinent flow sheets, particular for documenting on that patient's plan of care for that care set, will automatically attach and populate to the right. The last essential tab of this screen is the pencil buttons right next to each flow sheet. By selecting each of the pencil tab, you have the ability to immediately open the flow sheet and begin documentation. In Module 2, we will review each of these processes as we build a patient's plan of care, beginning with the admission process, moving through routine shift assessment and documentation, as well as intra-facility transfer, inter-facility transfer, discharging, modifying, voiding, charting new items, as well as performing co-signature when you're responsible for overseeing student documentation and/or functioning as a preceptor. This concludes the basic review of the Navigator and the Well and the associated Patient Care Management Profile tabs.